Childress, Texas is a rural community of about 6,000 people. We're geographically isolated, so we're 100 miles from about 6 different larger tertiary care centers. Childress Regional Medical Center is a 39-bed rural hospital. We have about 250 employees, and when it comes to most healthcare services in Childress County, we're the only provider. So we serve a very rural, isolated, poor population of patients. When a patient gets a cancer diagnosis, that's tough no matter where you live. When you're 100 miles from care, it's even worse, and it had been a dream of ours for a long time to provide some sort of local treatment option for our patients. Low volume was a problem, so we're never going to have volumes that would justify a standalone cancer program. We needed a partner. It was actually the 1115 waiver that created that new relationship between Childress Regional, Texas Tech, the medical school, UMC, and the Cancer Center. Historically, our predominant referral patterns were to other towns, but when we met the folks in Lubbock at UMC, they were the first partner to say, what you're talking about is what we can do and what we need to be doing for the region. So we've been providing local chemotherapy services to a small number of patients on a limited basis for almost a year and a half. It was the waiver that connected the dots for us and made a local treatment option possible. I'm thankful for that because we are changing the outcome for our patients. We're changing lives.
I'm Chris Haig. I live in Crowell, Ford County. My wife and I, we run a small art studio here in Crowell in which we concentrate on doing canvas pictures and customized picture frames. May in 2013, I just finished bringing in the hay crop and I felt very, very tired. And so I went to the hospital to get a blood test, and they said my blood, I had a third of the amount of blood that I should have in me. And I did a colonoscopy and found a tumor in me. And at that point, I had to go through surgeries. Dallas is a 4-hour drive back one way, so it's 8 hours back and forth. Driving that far for care can be just really traumatic on your injuries. And every bump in the road you can feel when you go over it, and you're just completely exhausted. And it was just a horrific thing to have to travel that far to try to get treatment. When you come into Childress, they have brand new chairs and brand new equipment. They have a very knowledgeable nurse. They bring in a doctor that's probably one of the best oncologists I've ever met. John Henderson took us around and showed us the whole hospital and, give us his cell phone number to call him anytime he needs his help. And people get to know you, they care about you. You walk in, they can tell if you're sick. Now I'm in remission. I credit first thing God, and then the knowledge and the compassion that the doctors have given me, and also the compassion that John and the doctors and UMC has provided me with the skills and the nurses and the medicines to just make everything actually work.
In rural Texas, there are things we just can't quite do without a little bit of help. The waiver has allowed us to find new partners, to build what I think is a viable pilot program for cancer care in rural parts of Texas, and we are so much better when we find ways to work together.